It's a pleasure to be with you. The title of this session is Organization and Financing of Public Health, Part 5, CDC, Birth Defects, and Chronic Diseases. There are no disclosures for this presentation. Objectives include review the roles of the National Center on Birth Defects and Developmental Disabilities and the National Center for Chronic Disease Prevention and Health Promotion. Discuss the current status of birth defects in the United States. Discuss the current status of developmental disabilities in the United States. Review major chronic diseases and their risk factors in the United States. Review the 4 chronic disease prevention and control domains of the CDC's National Center for Chronic Disease Prevention and Health Promotion. Review the role of community health workers in treating and preventing chronic diseases and addressing other community health issues. The last 2 sessions focused on CDC programs that addressed communicable or infectious diseases. We'll now consider CDC programs that address non-infectious diseases and injuries, including the National Center on Birth Defects and Developmental Disabilities and the National Center for Chronic Disease Prevention and Health Promotion. Birth defects, also called congenital malformations, are abnormal changes that occur in the fetus during a pregnancy. Most birth defects occur during the first trimester of a pregnancy, when most of the baby's structural development occurs. The National Center on Birth Defects and Developmental Disabilities, NCBDDD, conducts and supports research to identify the causes of birth defects, developmental disabilities, and blood disorders, promotes the well-being of disabled persons, and funds prevention and education programs. 1 in 33 babies are born with a birth defect. The CDC states that birth defects are common, costly, and critical. State-based birth defects tracking and public health research provide a wealth of information to identify causes of birth defects, find opportunities to prevent them, and improve the health of those living with birth defects. As reported by the CDC, the most common birth defect categories are brain and spine, eye, heart, mouth and face, stomach and intestine, muscle and bone, and chromosome or genes. This table lists the most common defect in each category and the frequency per births. The most common birth defect is a chromosomal or gene abnormality called Down syndrome, trisomy 21, 1 in 707 births, followed by a heart malformation, pulmonary valve atresia and stenosis, 1 in 1,052 births, and a mouth and face abnormality, cleft lip and cleft palate, 1 in 1,563 births. The most common brain and spine defect is spina bifida, which occurs once in every 2,758 births. Spina bifida can happen anywhere along the spine. When during fetal development, the neural tube doesn't close all the way, the backbone that protects the spinal cord doesn't form and close as it should. The 3 most common types of spina bifida are spina bifida occulta, meningocele, and myelomeningocele. Spina bifida occulta is the mildest type of spina bifida. With it, there is a small gap in the bony vertebral covering of the spine, but no opening or sac on the back. The spinal cord and nerves usually are normal. This type of spina bifida is usually not associated with disabilities. Another type of spina bifida is meningocele, when a sac of spinal fluid protrudes from the back but does not contain the spinal cord or nerves. This type of spina bifida can cause minor disabilities. Myelomeningocele is the most serious type of spina bifida, a sac of spinal fluid protruding from the baby's back that contains part of the spinal cord and nerves that are commonly damaged, resulting in moderate to severe disabilities, including paralysis. The most common eye birth defect is anophthalmia microphthalmia, occurring in 1 of every 5,243 births. Anophthalmia means that a baby is born without an eye. Microphthalmia means the baby's eye is small and may be associated with other abnormalities that reduce vision in that eye. The most common heart birth defect is pulmonary valve atresia and stenosis, seen in 1 of every 1,052 births. Atresia means absence, and stenosis means narrowing. As diagrammed, an absent or severely narrowed pulmonary valve restricts the flow of blood to the lungs, preventing adequate oxygenation. The most common mouth and face birth defect is cleft lip with cleft palate, seen in 1 of every 1,563 births. These pictures show cleft lip and cleft palate. The most common stomach and intestine birth defect is rectal and large intestinal atresia and stenosis, seen in 1 of every 2,242 births. These drawings show some rectal and large intestinal atresia and stenosis defects. Rectal malformations can present with not only atresia and stenosis of the rectum, but also abnormal connections with the bladder and vagina. The most common muscle and bone birth defect are limb defects, seen in 1 of every 1,943 births. These pictures show a few of the many presentations of limb birth defects, including the cleft hand, split foot, and talipes equinovarus deformity of the foot. The most common chromosome or genetic birth defect is trisomy 21, or Down syndrome, seen in 1 of every 707 births. Down syndrome is caused by the presence of all or part of a third copy of chromosome 21. It is usually associated with developmental delays, mild to moderate intellectual disability, and characteristic physical features of upslanting eye fissures, epicanthal folds, open mouth, protruding tongue, flat posterior head, brachycephaly, flat facial profile, small ears, and redundant neck skin. 50% of children with Down syndrome have congenital heart defects. The National Center on Birth Defects and Developmental Disabilities not only is assigned to address birth defects, but also developmental disabilities, which we will discuss for a few minutes. Developmental disabilities are a group of conditions due to an impairment in physical, learning, language, or behavior areas, and include autism spectrum disorders, ASD, and attention deficit hyperactivity disorders, ADHD. For most developmental disabilities, the cause is unknown. Known causes include genetics, maternal risky behaviors, smoking, drinking, illicit drug use during pregnancy, complications during birth, infections of the mother during pregnancy or of the baby early in life, and environmental toxin exposures of the mother or child, like lead. Approximately 1 in 6 children in the United States have one or more developmental disability or delay. Autism spectrum disorders, ASD, can cause significant social, communication, and behavioral challenges. Individuals with attention deficit hyperactivity disorders, ADHD, often have trouble paying attention, controlling impulsive behaviors, and being overly active. Children who have a sibling with autism spectrum disorder are at a higher risk of also having autism spectrum disorder. The Study to Explore Early Development, SEED, is a CDC-funded multi-year study to identify childhood risk factors for autism spectrum disorders and other developmental disabilities. Hearing loss often results in language and learning disabilities. At least 25% of infant hearing loss is due to maternal infections during pregnancy, like that with cytomegalovirus, CMV, complications after birth, and head trauma. Known causes of intellectual disability include fetal alcohol syndrome disorder, chromosomal abnormalities like Down syndrome and Fragile X syndrome, and certain infections during pregnancy, including rubella, CMV, and toxoplasmosis. A study using in-person assessment of school-aged children estimated that 6 to 9 out of 1,000 children had fetal alcohol syndrome, FAS. FAS symptoms and signs include low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, especially with math, learning disabilities, speech and language delays, intellectual disability or low IQ, poor reasoning and judgment skills, sleep and sucking problems as a baby, vision or hearing problems, problems with the heart, kidneys, or bones, shorter than average height, small head size. Abnormal facial features such as a smooth ridge between the nose and upper lip. This ridge is called the philtrum. Fragile X syndrome, FXS, is one of the most common causes of inherited intellectual disability. FXS is a genetic disorder caused by changes in a gene called Fragile X messenger ribonucleoprotein 1, FMR1. FMR1 makes a protein that's needed for brain development. People who have FXS do not make this protein, resulting in intellectual disability symptoms. FXS affects both males and females, though females generally have milder symptoms than males. Studies estimate that 1 in 7,000 males and 1 in 11,000 females have FXS. Toxoplasmosis is a disease caused by a protozoan parasite called Toxoplasma gondii and can infect animals including cats and humans. It is found worldwide. Pregnant women can get infected by ingesting the parasite after cleaning cat litter boxes, eating contaminated vegetables and fruits, partially cooked meats, pork, beef, venison, drinking unpasteurized milk, particularly goat milk, contaminated water, and eating raw seafood. An infected pregnant woman can pass the toxoplasma organism to her unborn baby and result in toxoplasmosis signs and symptoms, including eventual intellectual disability. Low birth weight, premature birth, and multiple births are associated with an increased risk of developmental disabilities. Untreated newborn jaundice, due to high levels of blood bilirubin, can cause a type of brain damage known as kernicterus that's often associated with cerebral palsy, hearing, vision, and dental abnormalities. Let's discuss chronic disease for a few minutes. A chronic disease is defined by the CDC as a condition that lasts 1 year or more and requires ongoing medical attention or limits activities of daily living or both. The National Center for Chronic Disease Prevention and Health Promotion, NCCDPHP, works to prevent and control chronic diseases by reducing their risk factors. The center also focuses on disparate and minority populations, since chronic diseases are more prevalent in impoverished communities. For example, in 2016, a study was published examining the prevalence of hypertension, arthritis, and poor health in counties based on their economic status. Poorer counties had a higher prevalence of hypertension, 9%, arthritis 13%, and poor health 15% versus more affluent counties. The CDC also states that American Indian Alaska Native people have higher rates of chronic diseases than other ethnic groups in the United States, twice as likely to be diagnosed with diabetes, have a greater prevalence of obesity, and are more likely to be smokers. The center's 2022 budget was approximately $1.3 billion. Major chronic diseases associated with morbidity and mortality in the United States include heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, and chronic kidney disease. These chronic diseases result in approximately $3.5 trillion in annual healthcare costs. 6 in 10 adults in the United States have one chronic disease, and 4 in 10 have 2 or more. 4 key lifestyle risks for chronic disease in the United States are tobacco use, poor nutrition, lack of physical activity, and excessive alcohol use. The center promotes chronic disease prevention efforts in 4 key areas or domains, helping achieve the vision of healthy people in healthy communities. The 4 domains are epidemiology and surveillance, environmental approaches, healthcare system interventions, and community programs linked to clinical services. Epidemiology and surveillance guides the CDC's use of resources, without which prevention and control efforts would be guesswork. CDC uses dozens of surveillance systems to collect data on chronic diseases and their risk factors, including Behavioral Risk Factor Surveillance System, BRFSS, Chronic Kidney Disease Surveillance System, CKD, Health-Related Quality of Life, HRQOL, National Assisted Reproductive Technology Surveillance System, NASS, National Adult Tobacco Survey, NATS, National Health Interview Survey, NHIS, National Health and Nutrition Examination Survey, NHANES, United States Cancer Statistics, National Youth Tobacco Survey, NYTS, Pregnancy Mortality Surveillance System, PMSS, Pregnancy Risk Assessment Monitoring System, PRAMS, U.S. Diabetes Surveillance System, Water Fluoridation Reporting System, WFRS, Youth Risk Behavior Surveillance System, YRBSS. These systems, often the only source of such data, help epidemiologists understand how chronic diseases affect Americans. Examples of CDC's epidemiology and surveillance work includes gathering and analysis of information from the multiple surveillance sources listed on this slide, measuring social and environmental factors that influence health, such as the number of fast food restaurants in low-income neighborhoods, tracking policies that affect chronic diseases, such as those related to smoke-free air, access to healthy foods, and community water fluoridation, measuring the number of Americans who get healthcare preventive services, such as cancer screening, the ABCS of heart disease and stroke prevention, aspirin use, blood pressure and cholesterol control, and smoking cessation, and measures of diabetes control, for example, hemoglobin A1C, and obesity, for example, body mass index, and uses health information technology to improve efficiency and timeliness of public health surveillance, for example, to speed reporting to state cancer registries. Healthy environments promote health and support healthy behaviors in community settings such as schools, child care programs, and work sites. A healthy environment reaches more people, is more cost effective, and is more likely than individual approaches to have a lasting effect on population health. Best practice examples include passing smoke-free air laws that cover all workplaces, restaurants, and bars to protect non-smokers from exposure to secondhand tobacco smoke, banning flavored cigarettes to make smoking less attractive to youth, banning artificial trans fats from the food supply to reduce the risk for heart disease, fluoridating community water systems, increasing prices for unhealthy products, for example, tobacco, alcohol, and high-calorie, low-nutrition foods and beverages to reflect the medical and societal costs of their use. Designing communities to encourage walking and biking. Giving children the chance to learn about physical activity and be physically active in childcare programs and schools. Increasing access to healthy foods and beverages, for example, full-service groceries and farmers markets, healthier menu items in restaurants. The right healthcare system interventions can help prevent disease, result in early identification of diseases, preventing complications, reduce risk factors, and better manage complications. Examples of effective healthcare system interventions include improving access to quality healthcare and preventive services, for example, cancer screening, blood pressure control for all. Health insurance coverage of preventive services. Healthcare reimbursement based on health outcomes. Increased use of health information technology, for example, reminder recall, providing timely patient information. Increasing use of community health workers, patient navigators, and other allied health professionals. Appropriate integration of clinical care with community-based allied health professionals and organizations, for example, certified community health workers, CHWs, pharmacists, parish and school nurses, home health care agencies, community health representatives, CHRs, and tribal communities, etc., can improve quality of life, prevent or mitigate disease processes, avoid complications, and reduce healthcare visits and costs. Examples of the integration of clinical care with community resources include increased use of community-based allied health professionals to support chronic disease management and prevention programs. For example, diabetes, smoking cessation services, cancer screening programs, heart disease, stroke prevention programs, etc., through clinical referrals and health insurance coverage. Enhance the integration of public health services with clinical care. For example, tobacco quit lines, immunization programs, cancer prevention programs, healthy heart programs, etc. In the United States, community health workers help meet national healthy people goals by conducting community-level activities and interventions that promote health and prevent diseases and disability. The value of community health workers not only applies to the United States, but can and does improve health and prevent disease and disability worldwide. Since community health workers typically reside in the community they serve, they have the unique ability to bring information where it is needed most. They can reach community residents where they live, eat, play, work, and worship. Community health workers are frontline agents of change, helping to reduce health disparities in underserved communities. Cost and access to medical care remain problems of worldwide scope, but are particularly severe in developing countries. It is estimated that 1 million more healthcare workers are needed in Africa alone to meet the health-related needs. Doctors are commonly concentrated in cities worldwide. In the United States, 84.4% of nurse practitioners and physicians' assistants and 89% of physicians were concentrated in urban areas where 80% of the US population reside. In Uganda, 70% of medical doctors and 40% of nurses and midwives are based in urban areas, serving only 12% of their population. Community health workers can enhance cost-effective health care and access in developed and developing countries, particularly in rural areas. Medical training for doctors and nurses is expensive, particularly in resource-challenged areas of the world. It is estimated that to meet the doctor and nurse workforce shortage in Africa, that world region would need to build 300 medical schools with a total training cost of over $33 billion and would take over 20 years to achieve. The training of community health workers is less expensive. Immigration of trained doctors and nurses to countries with higher salaries is common. In Zambia, of the 600 doctors trained since independence, it is estimated that only 50 practice in their home country. Community health workers may help resolve this shortage and distribution of doctors and nurses and are less likely to emigrate to other countries. They can be trained for specialized tasks such as providing sexually transmitted disease counseling, directly observed therapy for tuberculosis control, birth attendant services, limited medical and primary care evaluations and treatments. This table reviews Health Resources and Services Administration, HRSA, Community Health Workforce Study findings, defining specific activities of community health workers in the United States. 82% of community health workers in the United States provided culturally appropriate health promotion and health education activities. 84% assistance in accessing medical services and programs, 72% assistance in accessing non-medical services and programs, 46% social support, 36% translation services, 36% transportation, 34% interpreting, 31% counseling, and 21% mentoring. Other employers reported duties for community health workers that include case management, 45%, risk identification, 41%, patient navigation, 18%, and direct service provision, 37%. Some of the known outcomes of community health worker services include improved access to healthcare services, increases in community member health and screening, better understanding between community members and the healthcare, public health, and social service systems, enhanced communication between community members and health providers, increased use of healthcare services, improved adherence to health recommendations, and reduced need for emergency and specialty services. The World Health Assembly in 2006 called for a health workforce which is matched in number, knowledge, and skill sets to the needs of the population and which contributes to the achievement of health outcomes by utilizing a range of innovative methods. Community health worker training and assignment as part of the healthcare workforce is an innovative method to match skill sets to the needs of people. With training, monitoring, supervision, and support, such workers have been shown to be able to achieve outcomes far better than baseline and, in some studies, better than physicians. Community health workers are increasingly recognized for their powerful potential role in improving today's healthcare system. As mentioned, recent studies have demonstrated that community health workers can help to reduce costs and improve care, key goals of most governmental healthcare priorities. For this reason, many states in the United States are currently working to promote and formalize community health workers' role within the state healthcare system through certification. There is great variability in states regarding approaches to a certification process for community health workers. As with other healthcare professionals, some sort of licensure and certification credential for community health workers will be necessary for them to bill for and receive payment for the services they provide. Some states have established a board or work group to make recommendations for community health worker certification and training. In several states, private nonprofit organizations that support the concept of community health workers provide community health worker certification training that typically includes classroom training on core competencies, a practicum or internship experience, and an evaluation of skills and or knowledge. Development of national standards for community health workers' scope of practice, training, certification, licensure, reimbursement, and oversight is needed in the United States. In summary, 1 of 33 babies are born with a birth defect. Some of the most common birth defects are Down syndrome, pulmonary valve atresia and stenosis, and cleft lip and cleft palate. 1 in 6 children in the United States have 1 or more developmental disability or delay. 6 to 9 out of 1,000 school children have fetal alcohol syndrome. Chronic disease is a condition that lasts 1 year or more and requires ongoing medical attention or limits activities of daily living or both. American Indian Alaska Native people have higher rates of chronic diseases than other ethnic groups in the United States. 6 in 10 adults in the United States have one chronic disease, and 4 in 10 have 2 or more. In the United States, community health workers help meet national healthy people goals by conducting community-level activities and interventions that promote health and prevent diseases and disability.